Hello and welcome to this latest podcast. My name's Les Jones and I work with Practice Plan as a creative director. And I'm here with the lovely Lou Anderson, who's a RSM for Wales for Practice Plan. And we're at a BDA event in Cardiff, which is very apt because we're here to talk about the changes to the NHS Welsh dental contract. But before we get into that, Lou, welcome. Just give us a little bit about what you do with Practice Plan and practices.
Thank you for having me. What I do, as you say, I'm the regional support manager for Practice Plan in Wales, and I look after our existing clients, make sure that they're happy, that their plans are fit for purpose, what they need, and that everything's costed correctly. And I also do new business, and that could be introducing plans to practice for the first time, or it could be taking somebody through an NHS conversion. And we also do switch business as well. So if you're with a different plan provider and you want to switch to Practice Plan, then that's also part of my job as well.
Not much then. And I know, Lou, that you've been particularly busy over the last 2 or 3 months because the new contract came into play in Wales on the 1st of April. And you've been talking to a lot of practices since then. Just give us a little kind of indication of what the mood music is at the moment. How are people feeling about this new contract?
Frustrated.
Right.
Very, very frustrated. I've actually been working with practices for over a year in preparation for the new contract because we had notification from Welsh Government back last year that this contract was going to come in. We went through the consultation period, so I was helping and talking to practices then. So the practices felt that it wasn't for them. We were able to successfully get them out to the NHS so that they didn't have to partake in the new contract that came in on the 1st of April. For those practices who have remained with it, I take my hat off to them.
Right.
It's not an easy contract and it's unpiloted. So there are lots of issues and errors that the practices are having to navigate that they didn't necessarily foresee coming, even though Welsh Government had sent out the vignettes and we knew what case studies we were presented with. The reality of that is a lot more frustrating.
For those people who are not necessarily in the know, just talk us through some of the kind of the big changes that have come in with the contract.
Welsh Government have said it's not a new contract,
Right.
but it's an amendment, which is the first most important point because they could then get this through with very little notice.
Mm-hmm.
But to all intents and purposes, it is a new contract. So what we're looking at is UDAs have been abolished, so the way that dentists typically get paid. And what we now have is a segmented contract. So what that means is that certain percentages of the contract have been carved up. So you have to achieve different metrics in order to get your full contract value. So 70% of that is delivered with care packages. And those care packages, of which there are 19.
Wow.
That is where you're delivering most of your funding that you have available. So you can have patients who, for example, are in a care package for simple restorative. Then they could be in a package for a denture package. Then they could be in an endo package or an RCT package. So this is all segmented. So it's very difficult to explain to a patient now as well, because each of these segments and care packages come with their own costs. So the patient is now responsible for 50% of the costing as well, and up to a maximum of £384. But the patient now has to pay the laboratory fee on top of that as well.
Right.
So that's another big change that's happened. And then the rest of the contract then is made up of preventative, and that's 5%. 10% of it is for your high needs cases. And there's only a small percentage of 3% that's been allocated to recall examinations, so your historic patient base. The rest of it, 7%, although some health boards have increased that to 10%, is for new and urgent patients. So you've been encouraged to see new patients and urgent patients, as opposed to your historic patients.
That feels like quite a lot of change. Yeah, quite a lot to kind of get your head round. and in a relatively short space of time as well. What impact do you think that is having on the kind of the day-to-day running of dental practices with those NHS contracts?
How they're doing it, I don't know, because there's no way that you can accurately assess where you are.
Right.
Eden isn't real-time reporting, which makes it really difficult to find out where you are in terms of your contract value, what you've achieved and what you've got left to achieve.
Mm-hmm.
The software companies, it's not their fault, but they're on the back foot as well. So your software isn't working. So that's constantly being updated by the software providers. I'm speaking to practices and I spoke to a dentist and he said he actually forgot he had a patient in the chair because by the time he had sorted out the software,
Right.
then he had to obviously sort out which care package the patient was in. It's just taken so much longer. So it's just become an administrative nightmare for practices.
And do you think there's a lot of pressure for those practices to adapt to this new contract?
Absolutely. Absolutely. And they're doing it without proper guidance.
Right.
So Welsh Government have written the framework, but as we all know, the devil's in the detail. And unfortunately, the detail hasn't been provided.
Right.
Each individual health board is interpreting the contract slightly differently. Some health boards allowed child-only historic contracts to be continued. Some health boards didn't. So there's practices that have maybe had historic child-only contracts that are now hand to treat adults, for example, under the NHS. The patients can no longer just phone a practice and say, can you take me on as an NHS patient? They have to now go into the DAP, which is a dental access portal. Right. So they have to register on that and then they get allocated to the practice. So it's a lot of different metrics, a lot of different moving parts when the sole practices really want to do is treat the patients.
Yeah.
In the chair.
Yeah. It seems to me that not only the practices have been doing a lot of kind of catching up and reading on this new contract, but you yourself, you seem to already have a huge amount of knowledge about it and what impact it's having. Are there any kind of quick wins from a practice perspective that they can do to mitigate some of these changes?
Well, I'm a little bit sad. Right. So I was in NHS Dentistry, that combined actually a mixed practice,
right,
for 35 years.
Right.
And part of my job was looking after our NHS contract in practice for a group of 5.
Right.
So I've always kept up to date with NHS contracts and changes, and I've worked under a lot of the different schemes that we've had to work under. So I have attended all of the CTO meetings. I listened to the Senedd when they were introducing it, and I have read the vignettes from start to finish. So I'm quite knowledgeable about it, but I quite enjoy it. Enjoy it. It's an interest. It's the quick wins, as far as I can see them, are you need to plan.
Right.
You need to know what your contract value is. Carve your contract value up into the percentages. So 10%, 70%, 70%, and diary zone your diary so that you know that within some parameter that you're going to be allocating your diary time to the correct amount of proportionate income. And not allow the diary to become overwhelmed, for example, with historic recall patients because you know that that's only 3%. And to make sure that when you get those new patients off the DAP, that you're booking them in. So know your numbers, know how many new patients you need for the contract. Don't exceed it because you're not going to get any more funding if you do any more. And work on your practice model, know how many patients that you've got. Have a look at your historic patients and accurately work out as well how many of those you can see annually. Because nobody's going to pay you for doing an examination if it's outside of the metrics.
So I know you've been talking to a lot of practices across your area, Lou. What kind of support are you providing to the practices at the moment?
What I'm helping practices with, obviously I've mentioned that the care model is going in favour of new patients rather than your historic patients.
Right.
So in order to look after those historic patients who are now, because they may be dentally fit and well and you've looked after them for many years, their recall is going to be extended to a minimum of 18 months to 24 months. And that's obviously if you've got capacity or funding, but to see them even in that time frame. So what I've been helping practices with are setting up affordable, low-cost dental plans.
Right.
So the model that we were working in Wales prior to this contract was contract reform, and patients were encouraged then to be seen annually.
Mm-hmm.
So patients have now got used to, since COVID, only being seen annually in their practice. So to go back to a 6-monthly model, they think, why are we doing this?
Yeah.
So we're setting up annual plans. So the patient comes in and they have one examination, one hygiene appointment. Their x-rays are included. They get a percentage off then any additional treatment that they need. And they also get eligibility from our Worldwide Emergency Assistance Scheme then as well. So it's built into a nice little package. So we've been introducing those plans into practice, which is then a more stable alternative for patients as opposed to the NHS, for those patients that don't want to wait on the never-ending waiting list that may never come.
Yeah.
And to support that then as well, with some practices, we've done some mailings out to their NHS patients to inform them that these plans are available, but also as well to give patients the information that they need to know, such as fees have gone up and that patients are going to be expected to pay a lot more now for their NHS fees. And just generally supporting practices throughout the process that feel this isn't for them, and looking at alternative ways and more private way of working and maybe coming away from the NHS. I'm also giving another income stream as well and into the business.
Yeah. So well, you've just kind of picked up on what my next question was going to be there in terms of inevitably a lot of this frustration is going to kind of convert into perhaps a desire to move away from the NHS. And we see this a lot whenever there's kind of contract changes. It's the thing that kind of tips people over, if you like. So how are you helping those practices to kind of consider, whether they should really look to kind of move away from NHS dentistry and kind of take back control, if you like, of their own practices?
It's never lost on me how big a decision it is.
Yeah.
At the end of the day, the NHS, with all its faults and all its flaws, is guaranteed income into your business.
Yeah.
And I never underestimate, how big a decision that is. It also comes with the moral issues as well, that you're handing back an NHS contract. And a lot of people, dentists go into it for the healthcare. Mm-hmm. They don't go into it necessarily for it to be profitable. So what I do is we have a look at the business. We have a look at their NHS contract. We have a look at the income that they're currently getting. Then we do things like we work out their hourly rate.
Right.
So are they actually covering their hourly rate? Because we all know that a lot of times the private income that they're already generating is subsidising their NHS contract. So we have a look at that. Then we look at the NHS contract. So how much is your NHS contract value? But there's other things associated with that as well, because there's the NHS pension scheme, which we get our Wesleyan colleagues then to help out with that. But what I do is I take into account what they're currently paying for their NHS pension. If they've got a dental foundation dentist in, obviously that's another income stream that they're only getting because of the NHS. So we look at everything involved within the NHS contract, income-wise. Then what we do is we base plans on their fee per item, but we also, again, at their hourly rate, make sure that the plans are fit for purpose. And we look and we see how many patients they would need on plan to replace the income they're getting. And that gives practices a lot of reassurance. Because when you generally look at those figures, say you're currently treating 9,000 patients, you could only need 3,000 patients with you on plan, but to be earning the same income that you are under the NHS contract. So that's the first stage that we look at, is what would it take? How many patients do we need? And I do think the times are changing. The patients are starting to realise that the only true way to be registered, although we all know there's no registration under the NHS, but patients think there is, with a practice, is to be on a plan.
Yeah.
And to be a member of the practice. So then what we do is we make sure that the staff are on board. Because if we've made this decision, that we've looked at it and it looks good on paper and it's feasible, we also look at the demographic, the area. we have a look at how many of your patients are exempt, how many are children. Then we also have to have the conversation then about children's dental plans. So we look at it as a whole, and then we train the staff, and then we make sure that they're on board before we start anything to do with the process of any mail-ins or informing patients.
And what about the patients? What's kind of their response? Well, obviously there's been a lot of press about the new contract, so I would think for many patients there's an awareness of the changes. What's their response to kind of joining a plan and kind of looking after their kind of place, if you like, at the dental practice through a move towards private?
Surprisingly and overwhelmingly, patients are saying, "I'm surprised you haven't done it sooner."
Really? Right.
And they feel grateful that they've had an NHS place for that length of time. I think as well that within the media, obviously we know that there's wider issues with the NHS. We know that there's a cost of living increase. We know that people are finding it tough, but it's about proportioning the plan so that the patients that want to look after their dental health can afford it, and it's a manageable amount for those patients to pay. But when I've been in practice, because obviously when we do conversions, I'm in the practice, I'm there, I'm a member of staff that day, and I'm answering phones, and I'm, signing patients up on plan and answering any questions and queries that the practice's patients have got.
Yeah.
And overwhelmingly, I'm surprised you haven't done it before.
Yeah. Oh, and what about those practices, Lou, that you said you helped to actually kind of convert to private before the new contract came in? Those kind of preempted, if you like, some of the problems and thought, I'm going to jump ship now. What's been the kind of the response from them now they've kind of actually seen things on the other side, if you like? How are they feeling about the move that they've made?
I've recently done reviews with the practices that we've just completed the conversion, because we sent the letters out about January time, so
Right.
31st of March they were out of the NHS. They're obviously hearing from colleagues how difficult this new contract is to navigate. But it's more than that. It's a feeling within the practice, because when you go into the practice and they're trying to hit the metrics, trying to hit the targets, staff are rushed off their feet, administratively wise. They haven't got time to chat to patients. And when you walk through the door, you can feel it. You can feel the energy. And walking into those practices now in April and May, you walk through the door and it feels calm and everyone's relaxed. And reception have got time to have a chat with me. Shoulders are lower. Everybody just feels, and the energy feels very different within the practice. Patients seem happier because obviously they're not waiting as long for appointments, and they're being seen. They're having longer appointments. The receptionists have got time to chat. There's not the whole load of paperwork that goes along that they used to have to do. And yes, not one of them has said, "I'm sorry that I left the NHS." And it's always, "Why didn't I do this sooner?"
Yeah. And what's the kind of the time frame involved, Luke? Because I'm thinking back perhaps pre-COVID, when we might be helping a practice to make that move from NHS to private. And we would quite often do that over a full 12 months of kind of two, churns of a 6-month appointment to kind of get those patients up to the right level. Are you finding that the practices are able to get up to the levels they need to be a lot quicker now?
Yes, I mean, we still, if you're thinking of doing it, I would say contact us as soon as
Yes,
possible.
yeah, of course, yeah.
The more we can be prepared, the better.
Yeah.
But we did have some practices who made their decision beginning of December, and we were mailing beginning of January.
Yeah.
If needs must, we can certainly do it, and we can get up to that level.
But I'm also thinking about the number of patients signing up. Once the decision's been made and those letters have gone out, that actually the sign-ups are coming relatively thick and fast, I can imagine.
They are. And what we've got now as well with our mailings is we've got a QR code
Right.
on the mailing letter. So that directs the patient to a sign-up page. So that you're taking away the administrative burden on the practice, because the patient, when they receive their letter, they can scan the QR code and they can sign themselves up. I think that the practices did a great job as well when the consultation period came out. So I think a lot of practices informed their patients very early on that there were big changes happening within the NHS. The Welsh Government was going to introduce these measures. So I think the patients were primed, ready for it. But if practices are thinking of doing it now, then the NHS has changed the goalposts. There used to be a 3-month notice period that you had to give your LHB for to get out. Now it's 6 months.
Oh, right. Okay.
So anybody wanting to get out for 27
Yes.
would need to give notice on the 1st of October this year.
Right.
So if anyone was thinking of doing a conversion and being out for next year, I would say talk to us as soon as possible, because that window of October is going to come very, very quickly.
Yeah. Oh, well, it feels like perhaps perhaps this chat is very timely then in that respect. So if a practice is looking, perhaps just to weigh up their options, just to understand, what might be the things that would impact a decision, how do they go about that? How do they start that?
Give me a call, give me a ring. We've got NHS one-to-one conversations that you can book through our website. I'm happy for anyone to contact me via my email, which is louise.anderson@thepracticesplan.co.uk. You can also find more information on our website. And I would say just get in contact with us and start the process. Even if it's a conversation, even if you just want to pick up the phone and have a good moan at me and tell me all the stresses, tell me what you're going through.
Yeah.
And then I will learn so much through that conversation of how then we can help you, whether you are ready, whether you're not. There have been certain circumstances which, when we've started the process of looking at it, I've had to say to practices, we can't replace that income yet.
Yes.
So then we may be looking then at maybe doing more of a drip feed conversation with patients and getting them to sign up over a longer period of time. It's generally, if you've got a large NHS contract, that you need obviously the number of patients that to be able to mail to get the number of patients and the outcome that you want.
Yeah.
But start the conversation, talk to me, and there's always something that we can do to help, even if it's just introducing plans for now, getting your staff and your patients used to plan membership, how it works, how patients sign up, and then even if it's looking at a conversion further down the line.
Yeah. So it sounds like that it's not kind of a one size fits all. There are actually multiple different ways in which you can kind of ease your way into it. You can do it all at once, but you can ease your way in.
Yes, yeah. I mean, I've had practices phone me and say, I've handed back my contract.
Oh, right.
And that's a very different conversation, because then we're scrambling, obviously, to catch up. And likewise, I've had practices who say, I'm thinking of converting in 2 years. So it just depends on what part of the journey the practice is on, how comfortable they are with everything. But if you just want to know options, what's available, even if I don't do anything for the next 6 months, a year, 2 years, you've got that knowledge and information, and at least you know your numbers.
And I presume there's no obligation, there's no pressure. It's very much about support, not
Support, having a chat, having a conversation, and here to help.
Yeah. One last question, Lou. You say you kind of keep very close to what's happening with the contract with the Welsh government. Do you think there are likely to be changes on the basis of the frustration that's coming forward? Do you think there's going to be any significant improvements to the contract?
Welsh Government have said that as it's not a new contract, they can make amendments with as little as 14 days notice.
Right, okay.
Which again has been a source of frustration for the profession, because they feel as if the goalposts could change at any time. I don't see that anything major is going to change with it. Obviously, it's open for interpretation. I think that there's some things that they need to tweak. But at the moment, there's still so many claims and everything getting rejected. I think that we need to get to a point where we're level with the status quo before we think about changing and implementing anything else with the contract. And also politically, we've now had a change of government since the ones that introduced the contract. Absolutely. So that could be something that we could see some changes with.
Well, it sounds like, that you're a kind of font of knowledge about this particular contract, Lou, and that those people struggling to kind of make sense of the new contract at the moment would do very well to have a chat with you, even just to kind of, as you say, get things off their chest and find out what their options are. And we'll hopefully put some details at the end of this where they can get in touch with you. Lou, that's been fascinating. Thanks ever so much for your time and your expertise. Thank you.